good morning. Thank you for coming today. Thank you to the organizers of this event. This is an amazing event that doesn't happen everywhere, so I feel very honored and lucky to be a part of it today. And you would think that Dr. Swan and I actually sort of collaborated on our talks today, but we didn't. But I really wanted to ask you, why is exercise important? I'm here to talk about exercise, especially as it pertains to breast cancer recovery. And, just ask yourself, why is it important to you personally? And I can answer that for myself. It's quality of life, right? So we're here, we're living, and so what kind of life do we want to live? And something that really pertains to that and is really important is how we feel in our bodies and how able we feel, and how that enables us to be confident in everything we do in our lives. So, let's see here. All right, so all of these, you have this on your card in your goodie bag, and whoopsie daisy. All of these are really pertaining to the quality of your life. And these are things that Moving for Life, the method that I teach at Diablo Valley Oncology, directly addresses, which makes it a pretty unique thing for breast cancer survivors. All right, so to get you in the mood, you also have this in your little goodie bag. It's on that postcard. I'm going to adjust this so I can stand upright. So just a quick show of hands. How many people in here are physically active for at least 150 minutes a week? Yes, good. All right. So I stretch a few times a week to improve my range of motion. Who does that? All right. Not as many. How about I work up a sweat at least once a week?
Do hot flashes count?
That's a great question. No. And how about this one? I know how to be safe while being active. Yeah, okay, a little bit more than I thought. And I'm taking active steps to meet my weight and health goals.
Trying.
All right, yeah, trying counts. Trying is what it's really all about. All right, so that quote that Dr. Swan had up, it's not that you live, it's how you live, okay? So this is all about how we can empower you to live the best life that you can live. And there are two, I only have a limited time today, so there are two main points I'd like to make about Moving for Life. And one is about fatigue. These are the 2 points I would like to make are about fatigue and about lymphedema. And I chose these points because these are the chief complaints from, in my experience working and teaching Moving for Life. And what I'd like to say about fatigue is, I'm going to get a tiny bit technical for you, or with you. The way in which we work aerobically in this class, which is mild to moderate, it's not a huge, heart-pounding workout. We actually like to talk during class, so when you can talk without getting breathless, you're in the perfect heart range to really begin to wake up the body on a cellular level by changing the cellular metabolism, okay? So what does that mean? What increasing the cellular metabolism and waking up the body on a cellular level decreases fatigue by mobilizing the fluids in the body, chiefly the arterial fluid, right, distributing the blood to muscles and organs, the venous fluid of the blood coming back, which in turn also affect the lymph fluid. And so this affecting and mobilizing the fluids really sort of tells the cells, take the trash out, get all your gunk out. And I know that for a lot of you recovering, and even if you're not recovering, if you're just dealing with posture, people sitting at a desk all day, you have those aches and pains and your muscles kind of feel achy and almost dormant. And this is what this class is really geared towards, is sort of waking all that up, getting it feeling better, increasing breath capacity, which brings me to my next thing. How am I doing on time here? Oh, I can slow down. Okay, I'm going to take a sip of water. All right, so I see this before and after class all the time. And of course, class is 6 p.m. on Tuesdays, all right? So we're all kind of like, okay, we're here. What are we going to do tonight? And at the end of class, people are always walking away with more energy than when they came in the room, which is different from your typical exercise class where you're, like in a gym, fitness-oriented class, where you're really aiming to walk out of the room with less energy, right? You had a great workout, right? You just got rid of all that stress and all that strain, but you feel tired and maybe you feel like you need to go eat a steak, this is not what we're doing here. We're really aiming to get you feeling better by the end of class and giving you some tools to take home with you so that you can do this at home. I mean, this is, so that when you travel, you could do it when you travel, all right? So the second main thing that I would like to talk about is the lymphatic drainage part of class. All right, so this is a rib cage with no arms. And the reason I really like this picture is because we get to see the organs inside the rib cage. Chiefly the lungs. I keep pressing the wrong buttons here. All right, so chiefly the lungs, which is the purple. And what I like is that you can see the outward motion of the organs, that the organs support the rib cage from the inside out. So we work a lot on finding range of motion through the rib cage, through the arms, chest, back, from the inside out, which is kind of a shift from typical thinking where we think of outside in, right? So go ahead and, if you have anything on your lap, go ahead and sit up a little bit to the front of your seat. Thanks for being willing participants here, all right? So what we do a lot in class for fatigue and the lymph is to what I call work the breath, okay? So we use hands-on just to increase our awareness of where our breath is going. So you're going to place one hand here, and I just want you to breathe how you would normally breathe. This is where I move to that. All right. Hopefully I won't trip on the cord. Just gonna scoot over here a little bit. All right, so one hand is on your chest, one hand is here, or wherever it feels comfortable, all right? And just noticing how your hands move while you breathe. Maybe one hand moves more than the other hand. Okay, so now when we begin to work the breath, we consciously move both hands. So I'm moving them maybe out a little bit, and maybe they move away from each other, and then as I exhale, where do they go? So it's more of a discovery process here, and just finding as the rib cage begins to sort of warm up and open up, the hands begin to move differently. All right, so this is a very condensed version of what we do in class. Let's go ahead and take one of your hands, whichever one is comfortable, on your back, all right? Wherever on your back it works. Sometimes it's way down low. And then inhale, and see if your front hand moves more than your back hand. If that's the case, try to move your back hand. So now you're directing your breath more into the back space of your lungs. All right, and because of that, your rib cage is opening and closing. Now let's take hands to the sides here, again, wherever it works, to just feel what's going on. Yeah, be careful of your neighbor there. And inhale and try to make your hands move away from each other. So that's what we call lateral breathing. That's also an idea from Pilates. So you're breathing and the lungs move this way into the side bodies, which is often the most difficult. So let's just take 2 more breaths there, just sort of noticing what's going on for you. And again, we're working the breath because we can't find the lymph until we work the breath. It's all, it's all connected. It's really all connected. All right. So from there, what we're going to begin talking about is not only the 3-dimensional movement of the rib cage, but also the sponging of the fluids through the tissue, all right? So when we inhale, let me just move this to the side a little bit. As we inhale and working with the sides of the body, maybe you could either stand up for some of you, maybe you like to stand up, or for others, if you could just shift sideways in your seat a little bit, so you can move your elbows, all right? So when you're inhaling, you're moving the elbows up so you can open through the armpit, and exhaling to let those elbows come down. So the lungs become like balloons, inhaling and inflating, and then exhaling and deflating. And the whole unit opens, meaning your rib cage, and then closes, all right? So now we're gonna let that inhale really let your arms come up. So the arms are feeling the support of the rib cage and the organs. And then deflate, you get smaller. You guys are doing great. One more of those. So feel how that big inhalation through the lungs can increase that size, and then exhale. Everything becomes a little bit smaller. And so what we're doing is we're kind of putting the fluids on notice. Hey, we're about to mobilize you. All right, which is about what we're going to do. All right, so I'm pumping my hands. This is called sponging. Now, we're moving into more of the lymphedema side of things and really pumping the fluids through the arms, which starts with the hands. So what I'm going to do here is I'm going to squeeze my hands, I'm going to squeeze my elbows, I'm going to compress my rib cage, give myself a big tight squeeze. Now inhale into that and find that expansion. Now exhale, let it drop away, and reaching out through the wrist. So let's do that 2 more times before I really explain what's going on. So we're pumping, and we're squeezing hands, elbows. Give yourself a big, tight squeeze. Inhale. Take a really big inhale. Exhale. Let it drop. Good job. And reach. Flex the wrists. Yeah, good. One more. Pump. And squeeze. Big inhale. Breathing into the back. And exhale. Ha. All right, so that almost seems too easy to be true, that this would be something that you would do to get rid of lymphedema. I've had a lot of really wonderful feedback in class about swelling just going away from, this is just one tiny little section of what we do, but it's the main thing of what you're doing, because what happens when there's a blockage through the chest, you can take a seat, we're going to move again a little bit later, but make yourselves comfortable. So the lymph kind of doesn't understand where to go, especially when you have scar tissue, a lymph node missing. The lymph fluid kind of gets to where it's supposed to go, and if there's a blockage or an interruption in its path, it kind of just goes, right? It just kind of suspends there and it swells, and then gravity will pull it down into the arms, all right? So what we're doing here with that breath work, that inhale into a small shape, is we're actually getting the lymph right close to the skin. And then by exhaling and taking the arms up, we're working gravity to bring the lymph back down into the central body, plus the flexing of the wrist tells the lymph, go that way, okay? Because all it needs is direction. And that's something that you could do anywhere, right? Okay, so let me refer to my notes now. All right, so we just opened up the back a little bit. Do you guys feel that? Are you there with me? Feel different through your back? Let's just take a big inhale and just notice your breath. It's probably a little bit different than a few minutes ago, all right? So you all walked in and received these lovely pink straps on your chair. And it just occurred to me, I don't have a pink strap. All right. So real quick, before we start, look at your band. Make sure it doesn't have any tiny little hole in it. All right, just for safety. If it does get a hole or a little tear in it at some point, you're going to want to get a new one, all right, before it snaps on you. All right, so we just opened up the back. Now we're going to do a stretch with your band that you can do whenever. This is a great stretch if you spend, again, a lot of time sitting at a desk, which a lot of my clients do, or driving or whatever, just combating posture, all right? So what you're going to do, again, scoot to the front of your seat or stand, whichever works best for you. And you're going to take your band behind you with your thumbs pointing out. All right, so pinky fingers, really gripping, thumbs pointing out. Now we're going to take a big inhale into the chest. You guys know how to do that. Big inhale, good. Now pull your shoulder blades together, pull your elbows together. Now extend your hands, make sure you don't cock your wrists, that knuckles are down, all right? And we're big inhale, reach through the chest, and then exhale, let it all just circle down and around. Now if you want more of a stretch, you're going to walk your hands in closer. If you want less of a stretch, you're going to take your hands out further. So please make it feel good for you, all right? So inhale, lifting the shoulders, lift the chest, elbows, wrists extend, and then exhale. Good. Now this time you have to smile when you do it, all right? Everyone looks so serious. All right, big inhale, we're just stretching. Shoulder blades, elbows, wrists, and exhale. Now that's just a baseline. You can really play with that. You can rotate into it. I invite you to find what works best for you, because that's best for you. All right, so I hope to see some of you in class sometime. Thank you so much. And I would love to answer your questions.